flatten the sombrero, and avoid a camel's hump. How do we make sense of all those COVID graphs, charts and curves? And what do they tell us about how bad things might get? Prof Mike Tildesley, an expert in mathematical modeling of infectious disease, says we can take heart that death rates are still low, even as infections climb. Even in Bolton, the worst-hit area, there are only 2 COVID patients in hospital, while across all 18 areas in some form of lockdown just 141 people are hospitalised. Even with 4,000 new cases a day, it's still far off where we were in March and April, when an estimated 100,000 were falling ill. Prof Tildesley warns against reading too much into Britain's infection rate graph, or international comparisons. He says, the majority of testing used to be done in hospitals, and now there is a lot more testing in the community, healthier people with milder symptoms who probably won't need hospital treatment. That explains the steep rise in infections. We have to remember that 3,000 cases a day today is not the same as 3,000 a day back in April, because we are doing so much more testing. It's quite dangerous to compare one country to another in terms of their cases curves, because it very much depends on how much testing you are doing. Close quote. The younger healthy people behind the rise in infections could go on to infect elderly, vulnerable relatives, leading to a rise in hospitalisations and deaths. But it is not inevitable, said Prof Tidlesley. He added, there's some evidence of this in Spain. For a long time deaths remained low, but they've started to climb in the last few weeks. So we need to be cautious and keep monitoring that. But if deaths don't rise, it will be because healthier people are getting infected, and we are better at protecting the vulnerable. Close quote. There is also the possibility that the virus isn't as deadly. Prof Tildesley said, we know in the longer term viruses can mutate, and when they do they tend to mutate to milder forms, because it's not beneficial for the virus to kill its host. That, and the fact better treatments are available for hospitalised patients, may be helping reduce the death rate. Close quote. Dr. Christina Pagel, a professor of clinical operational research at University College London, and part of the Independence age group, is less optimistic. She said, it takes a week of you having coronavirus symptoms before it gets bad enough to go to hospital, and 2 or 3 weeks before you die, so there's a lag between infection and death. We won't see deaths going up for some weeks. It's not enough to just protect the elderly. The median age of people currently in hospital with COVID in Birmingham and Manchester is between 45 and 55. It's the parents of the young people who are getting infected. Dr. Pagel believes the most reliable data is the number of new hospital admissions. She said, when I look at that, it makes me sad. On September the 15th, there were 194 admissions, with a 7-day rolling average of 154 per day. A week earlier, there were 84 admissions and a weekly average of 77. We're on just over a week doubling time. At current rates of doubling, we're 2 weeks away from where we are on March the 16th, a week before lockdown, when we had just over 400 admissions a day. And there is no way that test and trace will be fixed by then. Just a week ago things were manageable, but now they are already getting out of control. That's why I'm worried. As we are seeing more hospital admissions, we are definitely going to see more deaths, but I don't think it will be as bad as in March. And it better not be, because a third of our deaths were in care homes, and that is entirely preventable. Close quote. Prof Tildesley also believes that, whatever the scenario, the dire predictions of up to 250,000 UK deaths suggested by SAGE will not come to pass. He points to the excess death statistics, the number of people who have died this year compared to the average of previous years. After an increase in excess deaths at the start of the pandemic, by the summer, that number actually went below the normal average, suggesting that many of those who sadly died from COVID were people vulnerable to other causes of death. Coronavirus vaccine, he said. We tend to get a lot of excess deaths from seasonal flu in the autumn and winter, and it might be that unfortunately a lot of people who have died from COVID are the people most vulnerable to seasonal flu. This, and the measures now in place to prevent COVID, might mean that we don't see as many overall excess deaths from other causes before Christmas. Close quote. He also points to the fact that daily deaths from coronavirus are still much fewer than other causes, such as cancer, traffic accidents, or even seasonal flu. He says, of course, this may be because of the measures we've put in place to prevent it. But if we continue to see more people dying of the flu than COVID, then I do think this needs to be part of the discussion. We are getting more deaths from flu, yet we don't go into isolation every winter because of flu. There's still a lot of fear out there with COVID, where there isn't with influenza. COVID has become something we're worried about, because every day you're told how many deaths there've been, but we're not told how many deaths from car crashes, cancer or flu there have been. Close quote. Dr. Pagel warns against complacency. A lot of people are susceptible to COVID because they've never had it before, and we don't know what the long-term impact of COVID is. For instance, 20% of flu patients are left with kidney damage after hospitalisation, but for COVID that's 45%. And in study this week found that 85% people who left hospital after COVID need long-term health care. It's very different to the flu. So why were we warned about hundreds of thousands of winter deaths? Dr. Pagel says, that prediction was based on everything being the same as the beginning of March. There are now many more restrictions and rules which help reduce the spread, and people are behaving differently. People aren't crowding into small spaces, fewer people are using public transport. We've all changed the way we behave, and that has impacted on the predictions. And she warns that, unless greater restrictions are brought in to halt the rising levels of infection now, another nationwide lockdown isn't far off. She says, what we've learned is that some places and activities are riskier than others. Most of the transmission has taken place in pubs and restaurants, and people gathering in the homes. These are the things we need to prevent. What we've seen this year is that countries that take decisions early before things get terrible have done the best. And recently we have seen, in France and Spain, how waiting too long a second time can be equally disastrous. We need to act quickly to make sure those curves don't surge upwards once again.